go.
Yes.
But thank you everyone for joining. I just want to introduce myself. My name is Nakasi Apaka. I'm the founder of Black Girls Link. And for those of you that may not know, Black Girls Link, also known as BGL, is a Black women-led network that empowers Black women professionally and socially through sisterhood and activism. And I want to say, first off, as I said before, thank you for joining us for this important discussion where we're going to be discussing the racial health discrepancies and during the COVID-19 pandemic.
Mm-hmm.
And hopefully we'll learn from Caurice as to how we could properly advocate for ourselves during these times, especially when we go in for treatment for COVID-19. Everyone throughout this conversation, feel free to wave at us and also feel free to write in the chat. If you have any questions throughout the chat, we'll definitely address them and answer them at the end. But this should be an interactive conversation. If you have any questions, if you agree with us, give us a thumbs up, let us know everything, okay?
Yes.
But this needs to be a conversation that all of us need to be a part of, and we want you to be part of it too. Okay, so it's my great pleasure to introduce Caurice Wyner. She's a fourth-year medical student, and tonight she'll be sharing her personal story with us regarding COVID-19, and hopefully we'll learn from her story and learn how to properly advocate for ourselves when we go in for any treatment, but also if we fall into victim of COVID-19. So Caurice, I would love for you to introduce yourself and tell us about you and your professional background.
Okay. Hi, everyone. My name is Caurice Wyner. I am a fourth-year medical student at Frank H. Netter MD School of Medicine in Connecticut. I'm originally from the Bronx, New York. I still have all of my family out there. I am a mother to a 1-year-old baby girl named Michaela. I just had a very impactful year during 2020, and I think it's changed my life forever. So I'm just happy to be here to talk about my experience with everyone.
Awesome. So let's start off this conversation just talking about your story. Tell us how you and your family got in direct contact with COVID-19 and your experiences in getting treatment for it.
Okay, so this started last year. I can't believe COVID is like almost a year old, or basically a year old. So this started last year around March. My baby was a couple months old, and I was in Connecticut working at Waterbury Hospital, and I was on my surgical rotation. So we started to hear about COVID, but I didn't really know how serious or crazy it would get so quickly. We were overwhelmed on that rotation, and we were just wondering, would we continue on? Are we going to be sent home? But it was also around the time of my mother's birthday, so I decided to go home just because I wanted to see her, have dinner with her. I've been going back and forth between New York and Connecticut with my child and stuff. So I decided on the whim to go home. So I remember this vividly. I had a 24-hour shift. So it's technically 28 hours when you think about sign out and everything. So after that, 28 hours of work, I drove from Connecticut to New York.
Wow.
That was the best decision I made in my life. So went home, celebrated my mom's birthday as usual, went to eat, and then within the Monday, the whole city shut down. New York City schools were shut down. My medical school actually told me that rotations would be stopped. So, I was in New York, so I decided to stay home because I literally couldn't go anywhere. Thankfully, that's where I was because obviously my parents needed me. So a couple days, really shortly after the shutdown started, my dad had a cough. So I was just thinking nothing of it,
This is right in March, right?
This is the first COVID cases in New York, New Rochelle, the very, very beginning of the pandemic. So my dad had this cough. He's an Uber driver. He's a truck driver. I didn't think anything of it. Like I say, I try to be calm in my family and lean on the positive side and, not freak anyone out, especially when it comes to health scares, because the news was crazy at this time. My family was fearful, especially my dad. So with the cough, I'm just like, you know, we were just outside. It's March now. It's getting a little warm. The weather is changing. Like all those things. I try to, you know, not worry him. So a couple days had passed and he still had a cough. So when I saw that the cough was severe, I tried to like say, okay, this might be, you know, something more. So let me try to get help. It was very hard to like secure him getting a test. Like I was most concerned about him. And mind you, this whole time we're in our house, so we're all exposed to each other. So it took like multiple calls. I called like 7 different hospitals, his primary care, everything. They were, because I didn't want him to go into the emergency room because he wasn't like that sick. He was like, you could take care of him at home. So I just wanted him to get the test so we could know, is it COVID or is it not COVID? So he got the test after like really trying very hard to secure this testing. I wanted so bad to get a test as well because I'm like, I've been with him. I'm in the hospital. I don't know if it came from me. I don't know if it came from, we don't know where it came from, but they wouldn't give me a test. I'm like, I have a 3-month-old baby, a mom with a RA, which is a immunocompromised condition, like please, but no, he didn't get, they wouldn't allow me to get a test, but what they told me is that I was lucky because he got one of the last tests, and now they're only converting to people getting admitted, getting tests. So I was like, okay, whatever.
Okay.
They sent him home with some cough. This is the first hospital. They sent him home with some cough medicine. We were all in the house. We like did like the whole isolation thing as much as we could because obviously I had to take care of him, and we just like waited it out. Then this was a long period of time, a couple days into it, he still had a cough. Now I'm having sweats and my mom is like not really eating and like having like vomiting, kind of GI and a cough as well. So we all have coughs. So I'm like, okay, this is a little worrisome. I'm getting scared. Like I said, nobody else could come into the house, like not even my fiance, my outside family. So it was basically me, my mom, and my dad, and the baby, because I was also scared to, you know, send the baby with anyone else because we don't know, like, is she exposed? Is she not? What we at this point we still didn't know if he had COVID. So that day we're like, okay, daddy is getting like, you know, his cough is getting crazy. So we decided to go to another New York City hospital, hospital number 2. Went to that hospital. They treated, at first when I got in that hospital, they didn't want to give me a mask. And I'm like, I need to get checked out too. Like I understand like masks are scarce right now, but like knowing that I had COVID, I'm thinking like look at all the people I exposed because they were giving me a hard time trying to get a mask. So we both go to the hospital, we get checked out. And you know, they do chest x-rays for both of us. Mine is okay. Daddy shows that he has pneumonia. So they treat him outpatient as like, you know, community acquired pneumonia, gives him antibiotics and sends us home. So that whole, like, this is like a multifaceted story. Like every time it like is reliving it, talking about it. So it was hard even like trying to advocate for him at that point, because when I was talking to the emergency medicine doctor, he didn't really want to, let me talk. And I'm just like, you know, I'm a medical student. Like I've been in this field for years now. I was a fourth year still at that point. I'm just like, you know, I've been taking care of him this whole time. Like let me say something. And he was just like, my dad is looking at me confused because he doesn't know what to say. And you could tell he's uncomfortable. And when he talks, it makes the cough worse. So I'm just like, you know, a lot of the things that I did during that time was like, take a deep breath, bite your tongue. You're in a desperate situation, and these are the only people that can help you. So the patients, I tried the patients to be so high because, you know, I have the perspective of working in the field as well. So I know it was overwhelming for them, and I know how it gets on both ends. But I was just like, dang, like someone listen to me. He's so like begging.
Ask, why do you think they were trying to shut you down and not advocate for your father?
I mean, you know, this is like something that I've dealt with during medical school. Like I'm a lot of times like the only person of color in the room, much less a woman. So I mean, like in my head, regardless of like if he had that intention or not, it felt like I was like being belittled or silenced, or like my medical opinion wasn't, you know, valid when I just went through all my rotations. So, you know, I actually didn't know something. And it's funny because he was being like really mean to me in the beginning, and then the emergency medicine doctor was like trying to, you know, make small talk with me, and like, because he knew what I was talking about, because I was suggesting that my father get some fluids because he's very dehydrated, and a part of his symptoms was like his mouth was so dry he couldn't like taste and talk and stuff like that. So I'm like, he needs fluids, and I actually had fluids at home, and me and my mom were about to give it to him himself, like inject IV, but then I saw that it was expired, so I'm just like, okay, we really gotta go to the hospital. So that was the main thing. He was not trying to listen to my dad and I when we're like, he needs fluids. Then after all the, you know, going back and forth, he finally gives dad the fluids. So I think after like he thought about his case thoroughly, and, you know, then he probably in his head thought like, oh, maybe what she's saying is making sense, and decides to give the fluid. Then he tried to give me some respect. And in my head, I'm just like, look at this guy trying to be nice to me because I'm saying I'm trying to go into emergency medicine, when he was just like had an attitude in the beginning. So after all of that, we get discharged, we go home. Mind you, still didn't have a diagnosis of COVID. In the hospital, when we both got checked out, they didn't check us for COVID. Like they said, the new rule is you have to get admitted for you to get a test. We get home, and the next morning we get a call. I get the message and the call that daddy has COVID. And I'm like, oh my God, everybody has COVID at this point. Like we were all together. Like I said, we were like trying to help him as much as we can. So I was actually like in his face. So I'm like, this is explaining why, like I was still going to school at this point, and I was like doing presentations and stuff like that. And I noticed that, why am I sweating so much? Like I'm really, really hot. And I'm like, I know I'm nervous, you know, I'm always nervous, but why am I sweating so much? So we finally realized, okay, like now everyone has COVID. So still at that point, I'm like, okay, we're trying to like work this out. Now that we know, we told the family and stuff, like people would drop us off food, and my sister's mother dropped off a pulse ox. So that was like a good metric for us. Something that I suggest people get is a pulse oximeter, because you can tell your pulse and you could tell your oxygen saturation. And that was basically my metric to know like if he's doing better, if he's doing worse. So
and where can someone get that?
Amazon. I get everything off Amazon. So you can get, I would suggest getting a pulse ox. I would suggest getting a thermometer. Also, just like those are my main two things: a pulse ox and a thermometer. You know, basic, you know, sanitizing stuff in case anything gets crazy again. But like those are good metrics. Like if you have a temperature, something's going on. If your pulse ox is low, something is going on. So you should get some medical care.
Gotcha.
So we were in the house, like this story has been going on for days now, and it continues to go on. But we're trying all the meds that the doctor gave us. We're trying herbal remedies. My family's Jamaican, so, you know, they had all these things on WhatsApp going on where people,
it's not
like,
just Jamaicans, Africans too.
where people like boil herbs and onions and orange peel, like, and then you have to sit your head under the pot.
The steam.
It was
I did that.
The steam. Everyone was doing the steam, so we were doing the steam. Daddy was getting frustrated, like this is not working. I'm getting frustrated, like okay, I'm a little worried. So we tried to do something to occupy our time. And at this point, we were like, I was getting scared because we were sick for a long time, and I'm like, I'm kind of like scared. To be honest, I was scared like for any of us to fall asleep, because if we, like, I don't know what will happen. Like it was that scary to me. Like, I think we all have to stay up. So what I did was we started watching a Netflix series. It's a football Netflix series. It was really good, but we like watched it for 4 o'clock, 6 o'clock, because it was just like, and I saw like Daddy going to sleep, and I'm like nudging him, like, you know, like it's scary, like it was really scary. So
and can you explain why it's scary for people to fall asleep like, I guess, the midst of the symptoms of COVID-19?
So, no, I think this was just like my own fear, like,
Okay.
just like because we were at the height of the pandemic and people were dropping like flies, and I see
Yeah.
my parents sick, I'm sick, and he's like not getting better. So I'm like, kind of scared, like go to sleep, something bad could terribly happen, and like not know what to do. So I was trying to like, it was like a way for us to bond and keep positive during the time, because we were all inside really scared, but no one wanted to say they were scared. They were just trying to like be strong for everyone else, but in the inside we were all like freaking out.
That makes sense.
So it came to the point where like my dad was like walking up the stairs, and then I noticed him in the bathroom, because the bathroom is upstairs. I noticed him like huffing and puffing and like leaning over. I'm like, okay, like what's going on with you? So I used that pulse ox, and I like saw the number like drop to 75, which is like a terrible number. So that's when like the panic really came in, and I'm just like showing that I have worry, and I called 911. I like, went away from everyone, trying to like keep my mom and stuff calm down, like baby and everything calm down. And I walked away and tried to call 911. At that point, like the phone lines were like not really working well. Like I called 911 and trying to get someone, 10 minutes passed, no one came, 20 minutes passed, no one came. Like it was like, and I'm just like looking at him, watching, like just in my head, what do I do? What do I do? What do I do?
Yeah.
So I was seeing like that I was waiting a long time. I'm like calling them back multiple times. They're like, there's nothing we could do. It's busy. Okay. So then the ambulance gets there.
How long did it take them to come?
It was like 45 minutes, and I like the worst 45 minutes of my life. They come, and when they're there, like they were like, I was trying to, get into that doctor mode. Like, this is what's happening. We're diagnosed with COVID. This is my father. He's the worst. He's 57 years, no past medical history. Like, really trying to, how I would do if it was any of my patients that I don't know.
Yeah.
The EMS, terrible attitude. Didn't want to enter the house. Obviously, like, I'm not trying to bash anyone by all means, because I know everyone had their own fears, but they were unprofessional, and they didn't want to come inside the house because we didn't have masks. At that point, where were we supposed to get masks from? There was a shortage of masks. No one had an N95. No one had a mask. We were working with what we had. So yes, we were in the house. It's crazy that a medical professional like myself did not have a mask in the house. And, these people were scared to come in because I just told them that, he's diagnosed with COVID. It was so terrible to the point where they wanted my father to walk outside by himself to get onto the ambulance. Like, they didn't want to come. How ambulance is supposed to enter the house, lend assist, even if he doesn't need a stretcher, give him a chair or something.
Yeah.
Didn't want to do that. I'm like, oh my God. So now I'm like upset and, like going back and forth, like, why are you doing this? And the hospital, they wanted to send us to, they're like, it's protocol that we have to send you to the nearest hospital. The nearest hospital is a community hospital. Personally, my family had a bad experience there because, my aunt passed away at that hospital. So, and we felt, her care wasn't proper. Like, she died, her death was preventable by the care that she got. So, we have ill feelings towards that hospital, not the greatest. And he's like, this is protocol. And I'm trying to explain to him, like, my dad will refuse to go to that hospital. Can you please send us to this hospital? Because I knew someone there. And I'm like, if I fight to get them through the doors, I know I have people there that could, look after them. So didn't, can't do this because of the policy. I said, you know what? F it. Jumped and ran to the back of the driveway. Mind you, I'm sick. Mommy's sick. Daddy's sick.
And you had a baby.
Huh? You had a baby. At that point, my brother came in because he was like living on the lower floor. So we left the baby at home with him. But reversed the car out the back of the driveway, got everyone in the car, sped by down the block. I see the ambulance parked on the corner of the corner of my block. Like I said, like when you talk about this, everything like comes back. So I'm just like, why are they sitting there? If you made this call that you can't, help me, why are you not rushing to help someone else?
Yeah.
had to help myself. So this point, like, I vividly remember being on the phone with one of my friends, like in a frantic, like, oh my God, like I'm rushing them to the hospital now. Like this was his stats and stuff like that. And my friend is trying to tell me to calm down because, like, imagine me a frantic with the phone driving. My dad is like slow down, like really scared, you know. So I'm driving to the hospital, skipping lights, you know, like if it's safe, trying to get them there because this is the biggest emergency of my life. So I even go into the hospital and I'm like going down the wrong side because I'm in such a frantic. And it was like they weren't, you know, like when you see the movies or like Grey's Anatomy or something, when someone is flying in from the hospital, all the doctors are waiting outside to come get them, especially if the person is in critical care, and, you know, get them into the hospital, get them the fastest care. That was not the case. It was just like everyone was, it's the middle of the night, by the way. This is like 1 o'clock in the morning. Everyone is just like not wanting to really interact with anyone. So they're looking at me crazy because I'm driving crazy, but I'm just like, this is an emergency. I'm like, we are all sick. We have 6 people in the car. Fine. My dad is like the worst, so they rush him in. But my mom and myself were still, you know, outside. So I have to go find a way to park the car. So I leave my mom, park the car, and basically go back as quickly as I can. So at this point, the hospital, there was like outside tent. So it was like 30 and under was pediatric. So I'm under 30. So I went in a separate side than my mom, who was on the adult side. So basically it's like a triage kind of situation. Like, you know, when there's like a mass disaster going on, everyone is in these little huts. It was like real life like that. So my mom is getting checked out. I'm trying to get checked out. But like I have like this bad feeling like something is not going well. So in the midst of like, you know, getting checked out, they were saying like, you know, I have to go inside to get a chest x-ray. But I wasn't feeling like my mom was getting like the care that she needed. So I was just like, okay, hold off on taking care of me. I have to go check on my mom to see what's going on. So then I therefore go over to the other side and I see that it's raining that day too, and it's freezing cold. And you know, when there's an emergency, you jump out the house and like barely nothing on. So she's shivering, she's cold. Like I said, it's been 6 days since she hadn't ate anything or kept anything down, and they're trying to discharge her. And my mom is a very feisty person. She's like, you know, all about like getting what she deserves, and you know,
as she should.
If the thing has a little scratch if the table she just bought has a little scratch, the car she just bought has a little scratch, she's trying to take it back. So she just has that defensive, feisty personality. And she was just like, you know, I want to go home. Like, I'm just tired. I'm just like, I can't, like basically saying like she can't fight them no more to try to get care. And I was like, absolutely not. You're not going back home into my care because you're not well enough. And I know that you need to get admitted to the hospital. So like, that's the point where I march over to like, I don't know if they were nurses, doctors, interns, residents. You don't know who anyone is because everyone has the same uniform on. And it's just like, assembly line basically. So I'm trying to get someone's attention, like, my mom, you guys just charged my mom, but she's not well. Look at her. She's like nauseous, throwing up. He was like, oh, we gave her an antiemetic, which is like a nausea pill. And I'm like, she's sitting there right now. She threw up the pill. Like, can you, like, I had to get real serious with them. Like, do you not see her spitting up? Can someone bring her inside to the emergency room? So
I was in the waiting room at that point.
We were outside in the cold, in the rain, in these tents that have these fake heating boxes. So I'm just like, I was sitting there like my legs shaking, like I can't believe this is happening. Mind you, I left my care because I'm just like, my mom needs me. So I waited patiently. I sat 5 minutes and I went back to him and I said the same thing over. She has not eaten for 6 days. Can you please do something? So I guess he talked to someone else, finally got my mom in. I'm like, okay, mom, regardless of what's going on, they're both inside of the hospital. So I should be okay. Let me go check myself out. You know, go back to going through the process of getting the care. Like, I go back over there and they tell me, because you left before, we would have to start the whole process over. And so basically I would have to go back do all of that. I was just like, really? Like, I really had to go to the bathroom. It was like portal potties outside. So I ended up having to go to the portal potty. And I'm just like, please, like, I was just here. This guy just told me, like, if I wanted to go check on her and I come back, that, they'll be able to help me out. Mm-hmm. No, I had to start over. So at that point, I was so frustrated that I just started crying, and I just left. Mm-hmm. And I went back to my car and I cried, and I sent a voice note to my family about, like, frantically about everything that's happened. Yeah. I tried to, like, FaceTime my parents to see what was going on. They were at both opposite sides of the ED. Mm-hmm. Daddy was in critical care. My mom was on the other side, like, trying to communicate with him, but it was hard to get in contact. I'm trying to call the hospital, see if someone could tell me what's going on. Mm-hmm. So I tried to do all that, and I sat in the car for a while until, like, there was nothing I could do but go home. Mm-hmm. So I went home, and then that whole process continued on for, the 10 days or so that they were in hospital, and then coming home and recovery and stuff. And overall, we all recovered, and my baby didn't get sick. Awesome. So she was good. Everyone is now healthy, so I'm grateful for that. But that is just, like, the tidbit of getting to the hospital. I won't even go into, like, what happened, like, while they were at the hospital, because I know you want to get to other topics. But it was just a crazy experience, like, nothing that I can explain.
So I want to ask you, how has that experience changed you personally and also professionally as a medical student?
So personally, it's just made me so much of a stronger person. Like, I was feeling a lot of brokenness. Like, I just lost my grandmother in February. Mm-hmm. The next month this is happening. I have a new baby, all these important things going on in medical school. So I was kind of feeling broken at the point. And just looking back on the times, like, I think it was just like something that had to happen to me for me to just be stronger and be an advocate and try to, tell other people, like, from a firsthand experience, how to help. And, instead of, like, it's such a personal thing, instead of shutting down and being very private about health and stuff, because, that's the normal thing that people do. I was, like, very public and open and sharing, like, this is what happened to me on Facebook, anywhere I could get to. Then I started doing these podcasts, and it led to the article that I published and another article by my school. So it changed me personally and professionally. I thought I wanted to be an orthopedic surgeon. Mm-hmm. I was drawn to that field by, like, the previous work that I did as an orthotic fitter at Columbia. Mm-hmm. And I came into medical school, applied to this program, and got into a big name NYU internship in orthopedics. So my whole time I'm like, orthopedic surgeon, that's what I'm going to be. Yeah. And then this happened to me, and I'm just like, I could survive a crisis. Like, I brought, my family through a crisis. I could bring patients through crises. I need to be in the emergency room. And that changed my specialty to emergency medicine.
Yeah. So you talked about how that made you change your specialty, but how did the experience help you change your view of medicine and how people actually practice it?
I've always had, like, different views because, I'm the med student, the family giver, the patient. Like, I've had, all those perspectives this whole time, but, like, feeling how it felt for such a, like, desperate situation, and, some people not, like, being supportive, like some doctors, like, letting the stress get to them and probably not putting on their best, bedside manner. It was just like, oh my God, I can't be like this, because I know how it feels when I'm on the shoes on the other foot, and it's my family member, it's me being sick. So it's my daughter, like, all of these things. Like, I was just like, this is, like, very hard, like, being a medical student in a pandemic, everything going on with, Black Lives Matter and, people getting killed. All of that stuff was just hard for me to bear in medical school. And it was just like some people I had different views of, like, you know, some, you know, doctors and stuff like that. It kind of changed my view, but I never like judged them, because I tried to be as, you know, graceful as I could during the time, like just trying to give everyone grace. Like with COVID, when, you know, with COVID fears, with people who have, you know, certain fears of going places because of COVID, because I went through it so early on, I always try to give people grace. Like, you know, everyone has some kind of trauma that they went through. It's not just me, you know? So I tried to understand like the people that were working there, because remember, they were short staffed. No one had resources that they needed. Doctors passed away because of this, fighting on the front lines, nurses, a lot of things happened. So I tried to be humble, but I tried to also like use everything I've learned to be like, okay, this is the type of person I want to be when I'm treating my patients. This is what I don't want to do, you know?
Yeah. Do you feel like the way your family was treated, or have you experienced treatment at a hospital based on your race? Do you feel like you were treated differently based on your race?
I mean, that is like a factor in medicine, like, period, before COVID, and now even more exposed during COVID. So at times I do feel like it has to, you know, do with race when it comes to like, I know what it feels like to be like have imposter syndrome, to, you know, people say microaggressions that are like not outright, you know, racist or like discriminatory, but you know the feeling when it's like, okay, what you said was a little bit off, and I'm not going to pull the race card all the time, but you may have some unconscious bias, because not saying that everyone is purposely doing things they're doing, but bias is a real thing that everyone has. So you may, you know, have a perception of my family or my father or myself because you interacted with someone of the same race, but you can't, like, this should teach us that we have to break down and, you know, start from square one when we're thinking about everyone. Every person is a new person. You have to just have a clean slate when you're, you know, treating patients. And yeah.
So I just want to go back, and so we could, because that happened last year, March, right? And I'm pretty sure a lot of things have not changed since then. But I just want to know, what should people expect when walking into the hospital with COVID-19 symptoms, and how should they actually go in prepared to advocate for themselves and their family?
So what should people expect? So it's kind of like a different, it's kind of like people, we're more experienced, like we know about COVID, you know, vaccines are rolling out and stuff like that. So the care should be, you know, better than it was when, you know, we were scavenging for ventilators and stuff like that. But I think people should be aware, like, if they are discharged because, you know, their symptoms are mild, be aware that, you know, COVID kind of has this pattern where you're fine and then you're just not fine, and then you get better and then you crash. So you have to be aware of the fact that, you know, even though you went to a lot of people may feel, you know, I went to the doctor already. If things get worse, like I already went and they told me that I'm okay. Like things change. So, you know, you got to go back if you feel like something is not right. Another thing that I like to suggest to patients and stuff like that is, like, if you're going to the doctor and, you know, you get this treatment plan and you have a question about something, don't be afraid to ask that question. Like, if the doctor doesn't ask if you have questions, mention that, you know, I'm confused about something. And the prime way for a patient to know that, you know, his doctor, him or her, the doctor and the patient are on the same page is like, okay, you told me so-and-so, repeat it back in your own words to them and make them, you know, say, okay, yeah, you have it correct. Or no, there's some adjustments in how you are processing it. So that's another thing that we are sometimes taught, like, you know, so what do you get out of what I just explained to you? Or what do you want to know? Like, if that is not mentioned to you, that's something that you could keep in your back pocket. Like, so you said so and so and so. Is this what you really mean? And if they say yes, you're all good. And if there is no, then you have some adjustments in what you can understand, and you can ask more questions. Don't be afraid. And if you really disagree with some, you have autonomy to disagree with your care or with, medical advice. So just know that you have power and try to use it as much as you can.
Yeah, that's great. And so should the person in that situation, like if they're in an emergency room, should they try to ask for a second opinion? Is that even allowed? Are they allowed to do that?
In emergency rooms, asking for second opinions, I mean, like, you have the right to, ask as many questions as you want. Like, I'm not really sure about how the process of goes of like refusing care, but like, even though you get that advice and you don't agree, you always are welcome to go back to a different hospital, or like I said, it took me 3 hospitals in New York to get the proper care. I went here, I didn't like how it was going, went somewhere else, didn't like how it was going, ended up going somewhere else. So
Yeah.
do whatever you can to, make you feel comfortable.
Do you have any other questions that people, particularly Black people, right? Because we know the racial disparities that take place in the healthcare system. What questions we specifically should be asking regarding our healthcare treatment for COVID-19, but in general? Yeah.
So what specific questions can you ask? I mean, I think it's like a lot of things that we learn in medical school. There's like, I feel like there are some gaps, and that's why I'm like trying to do research to understand like how we can make the curriculum anti-racist, like knowledgeable of people from different backgrounds. Diseases may present different in different cultures. So I think it's important, like if you're scared about something, or you don't know, or say you have, like a lot of people have home remedies or things that they feel like culture remedies. Like we're trained as physicians to be able to understand anything. So if you have a question about your care, and it's like a herbal remedy, don't feel afraid to bring it to your doctor. They shouldn't shut you down from anything. Like, this is like, like I was saying, the steam in the face and stuff like that. Supplemental things and herbal things are important as well. So I think it's important for us, to not be afraid or ashamed of anything. Like your doctor is someone that you should be open and honest with. And you want to, if you feel like something runs in your family, or you feel like, this has affected my race more than other people, how should I handle that? That's an appropriate question to ask your physician. So I think that is a way that you can get as much resources from the hospital, from physicians, as just like being open with what you have on your mind, and like no matter what it is, you should be able to tell your physician, if anybody.
Awesome. I just want to remind everyone that's listening, go ahead, and if you have anything to add to the conversation or any questions you want us to ask toward the end, let us know. I'm going to ask her a few more questions, but go ahead and write any questions you may have. The next one, you as a 4th-year medical student, do you feel like medical school properly prepares and trains future doctors to care and serve like groups of people, minority groups of people during these times?
So I think that, medical, like I only know my medical school curriculum, and I think, things are mentioned, but I definitely think that a better job could be done. That's why I want to invest my time, now that I have an extra year to do research. I want to invest my time in trying to improve the curriculum and, improve like how we are taught things, because social economic background does affect people's health, and it has a strong impact on like the care you receive, the resources that you have, how often you go to the doctor. So I feel like when it comes to certain lectures that I listen to in school, I feel like they can add more to how physicians should think about social determinants of health. I think, there's lectures and stuff, but I think that there's a long way to go, and there's many ways that medical schools can improve on, you know, teaching doctors to have empathy, to understand where people are coming from, to be able to treat any person, no matter race, gender, all of those things. So I think there's a little bit, you know, an effort, but I think there's a way more that can happen to improve on how we train our physicians. And, you know, medical school is where it starts at. That's why like I want to start like my work there. And then just the percentage of Black doctors, minority doctors in America is so low. Like, you know, a diverse group of people will, it's like diversity is excellent. Like, you know, some people or institutions think otherwise, but like everyone should know diversity equals excellence. So it's disheartening when I hear stories like I was talking to you about this before about the Black program director at Tulane, how she was fired because of like basically because of racism. And it's just like, you know, people in leadership at that institution felt like having a Black woman as a program director would steer away white applicants from that institution, and that's the problem. Like, it's a person, a future physician should want to be in a diverse environment. So it disheartens me to know, like, I've been spending all this time, sacrifice my family, my child, like, you know, missing out on, like, I see everyone living their life and I'm like in these studying. Like,
also student loans.
Yes, a couple $300,000 to $400,000 for a medical education, which is a problem. But I since my whole life I've been working towards this dream for me to be able to look at this person at the top of their career, at like one of the high director, program director. Like, that's a big title. You could work your whole life to get there, and someone could just take it away from you like that. That's scary for me. You know, like, it's just like, you work so hard and anything can happen to you. Someone could just like have a bias for no reason against you, and that could affect your life, affect your family, affect your income, all of those things. Like, I feel terrible for that doctor, because I know the blood and the sweat and the tears that it takes to get there, like, to what I'm going through. And she's like all the way down the line at like one of the highest positions that you could get. Like, that was that program's first African-American woman program director, and she got fired.
And if you don't have people in place, people of color in place to show this is how you treat people, minority groups in a society, then people that are in medical school will not be able to learn, right? They will have firsthand experience and actually have representation matters. That's why, because you're able to work with someone that looks like the people that you serve. But if you don't put people in places to do that, they will be ill-equipped to do so. So you were talking about that story, and that was ridiculous. So I guess for me, like, to make sure that we come out of this conversation empowered, right? And making sure that we come in and understanding, knowing the realities of what the system, how the system is. What advice would you give to any person of color in the medical field, in regards to how they navigate it? And I'm pretty sure you're still going through your own journey now, but what advice would you give them?
So you mean like a person of color trying to become a doctor as well?
Become a doctor, or is someone else in the medical field? Yeah.
Like health related field.
Professionals. Yeah.
So I am like, that is one of my biggest passions, is helping people get into medical school. Like, I give out my number, I give out my email, just so that they can have a face-to-face. Because before I became, you know, in medical school, I didn't really know many people to turn to who had this experience. So I think seeing is believing. And, you know, I want to make an impact on younger kids. This starts from like pre-K. If you feel like, if a young 5-year-old kid feels like they could become a doctor, they will become a doctor. And my advice is just like, you know, even when it gets tough, and like sometimes you think about like, why are you doing this in the first place? Like, just always try to sit down and take yourself back to a moment where you like pray for this, you cried for this, you know, you wanted to be here so bad. Like get back to the root of why you started, because there's a lot of times that it gets tough where you're just like I'm sacrificing my whole life and, you know, I'm still going through all of this shit. What is the point? So when I get to that happens a lot, and I'm like, you know, I have a lot of friends in med school, and I try to talk to them like, you know, we're here, we put in this work, we just got to keep on going. Like at this point, like I feel like I have no choice, but because I know that, you know, me being in such a high position, I would have a wider impact. Like, you know, I already feel my impact as a medical student, and, you know, being an advocate, especially like through COVID, like how I like, you know, started to put myself out there, be on podcasts, be on, you know, be in the media. Like that is not me. Like I'm kind of shy, you know.
It's becoming you. It looks
well,
nice
like I just try to like use my story as inspiration, and I actually like want to make a documentary about like all that I went through in medical school, and I want to like visit, you know, middle schools, high schools, and like do mentorship work, because like when you have contact with someone who's in it, it makes you feel like, okay, that's my next step. So when
they look like you
and they look like you as well, that's a big thing. So like when I talk to someone who's a resident and, you know, they were in my shoes a year ago, I feel like, okay, just hold on a little bit more, you're going to get there. Like someone that's an attendant, you always have to have that line of contact. You can't like, it's hard to go in somewhere blind without like having any support. So that's why I thank God for my support system and, you know, all the programs that have helped me along the way. And because I've had so much support, I am always willing to lend a hand to someone else, you know, trying to be in medicine. So if you ever know someone who's interested in that field, you could let them know that I'll be down to help them.
Definitely will. And I just want to remind everybody, if you have any questions, it's the time to write down the questions in the chat right before I ask the last question to Caurice. So my question to you is, what change would you like to see in the healthcare system and the medical profession to ensure that Black people and minority groups and also immigrants are not disproportionately impacted by the by medical care and their treatment for anything they go for? It could be COVID or anything, any form of sickness.
So you're saying like what advice?
What would you change? What would you change?
So what would I change? I mean, I think there needs to be physical, financial resources guided towards these initiatives. Like, it's great that, you know, we've had this big momentum with Black Lives Matter, and I appreciate all of that. But like, it's time for people to put their money where their mouth is. And when it comes to supporting, you know, getting Black doctors to join the force, and, you know, like it starts from a pipeline. So it starts from high school. Like we need to make programs where high school minority children are exposed to this field. Like that takes funding. We need, you know, healthcare for immigrants. We need healthcare for homeless. Like, though that takes funds. That takes people in high positions. Like, you know, that takes politics. It's just so much that needs to be done. Like, there's like not like one good answer that I think of, because I honestly think like the healthcare system needs a big revamp. But I think it starts with like, you know, training doctors on unconscious bias. That's something that I think will be very helpful. Dedicating resources, like opening more free clinics for, you know, there's immigrants who are scared to go and get healthcare because they feel like they could get deported. Like we need to eliminate some of those things, and that will allow people to be more comfortable to go to, you know, their primary care doctor before their condition gets terrible and it leads to their death. Like we need to invest in primary care and getting, you know, follow up for people. Like a homeless person comes into the emergency room, you know, they have this serious condition. When they get discharged, what happens to them? they go back onto the streets. Like, how is that gonna help their healthcare? Like, those are like things that I think about. Like, I know there's no easy fix, but I feel like people need to direct money towards trying to increase the amount of minority physicians, trying to help like people who have no healthcare. Those are just a couple of things that I could think about, because it's just like so many things are going on in the world, and you're just like, I'm a fixer. I want to fix stuff, but like, I think starting small and getting big and like, having people sponsor these things is like the first step.
In medical school and also in the hospitals, right?
Yes, in medical school, in the hospital, in the community, everywhere. You know,
for them to take responsibility of it and actually take hold of doing those changes.
And that starts. A lot of that starts with government funding.
Yeah, and, of course.
We just have a long way to go. But you know, I'm always positive. I like to err on the positive side, and just know that, like, first and foremost, I like look at myself and say, you know, I'm making a change just by being in the room. I changed the narrative for my parents. Like, if I weren't home and I was still at rotation, something completely different could have happened. I changed that narrative. So I try to walk in the room with, you know, that confidence that, you know, me being here is a difference. It makes a difference on the outcome of somebody's health. So I think just, you know, starting there would be a good thing.
Yeah. All right. Awesome. Thank you so much for answering all our questions. I just want to make sure that we have not missed any questions. I've seen a lot of comments and us people interacting with us. But I
don't see anything at all.
Really? Oh, okay. Hopefully I'll be able to show you later afterwards. But yeah, I see a lot of your family here. You got a lot of support, girl.
Oh my God. I don't see anything at all. Yes, I like on the low. I texted my mom like, "Mom, where you at?" Like, I don't see
here. I think she's here.
That's so funny.
But I just want to make sure if you could say any final words that you want to say, because I don't see any questions for you here. I think they're just showing you a lot of love and them just agreeing with a lot of what we're saying right here, right? So any final words before we head out?
My final words are like, you know, just encouragement. Like, I think we need to look at, you know, our people in healthcare, especially like minorities and stuff like that, who are going through this pandemic and are on the front lines. Like, we need to check on our people, because we need to check on people in general, whether they're in the healthcare in the field or not, whether they're white, black, blue, orange. Like, it's a hard time for everyone. This pandemic is crazy. You know, Black Lives Matter is the big thing. You know, a lot of people in professional fields are feeling uncomfortable when they're the only minority in the room to talk about being Black and being the only Black person there. That's a hard thing to do. So I just think we need to invest in mental health as well. I think that's a big thing for the healthcare, because how do we have people not able to see a counselor? Like, I think that's a problem. So my thing is just like spreading love, spreading kindness, like knowing. The biggest thing that I learned from this is no matter any situation that you're in, think about someone who has it worse. Think about, you know, seeing things on the TV. Think about how that could be you, because you could be watching it one day on the TV like my family was, and the next day it could be you. So just move with kindness, move with compassion, no matter like who you're dealing with, because you really don't know what they've been through. So I think that's just how I would end it, like spreading love, spreading kindness, spreading awareness. That's all I'm about.
Great. I don't see any other better way to end this. Because I'm all for that message. Thank you so much for joining us. I'll keep in touch for sure. And thank you everyone for joining us and having an interactive conversation among us. We'll have a part 2 that's happening next Tuesday on the 23rd. We'll be talking to Dr. Bell about the vaccine. Any questions you have, please bring them to that discussion. This is the time where you can speak to people that look like us, that can answer your questions regarding this vaccine that is being spread throughout the whole country. You have the right to know, and your answers will be heard and answered. Hope to see you then. Bye.
Bye.
Bye.